Hi, my name is Logan Bardron, and this is my research article presentation on platelet-rich plasma injections for lateral epicondylitis of the elbow to reduce the need for surgical interventions. So a little bit of introduction. Lateral epicondylitis is also known as tennis elbow, and it occurs on the lateral aspect of the elbow. It is a overload injury with repetitive microtrauma, and it actually doesn't occur as much in tetanus as you would think. And a little bit about platelet-rich plasma. It is a natural treatment using a patient's own blood to promote and accelerate healing. So the clinical purpose of this research study was to assess whether the introduction of PRP injections for lateral epicondylitis would lead to a reduction in patients subsequently undergoing surgical release of the lateral epicondylitis. So a little bit about the methods. So the patients had to be diagnosed with an MRI. The period identified in this study was January 1st of 2008 to December 31st of 2015. So prior to 2012, PRP wasn't available. So those responding to conservative treatment were treated with surgery. After 2012, patients with any symptoms that previously would have been treated with surgery were then offered PRP injections. For that, the number of patients that underwent the release as well as underwent PRP injections were recorded, and the number of patients requiring surgery was compared to pre and post PRP injections. And this was put into a chi-squared test, which we'll look at a little bit later, or we'll talk about a little bit later. And a little bit more about the methods. The surgical technique that was used was an arthroscopic release. So with that, the elbow was distended using saline, and there were two portals that were injected into or put into the elbow. So one was on the lateral aspect, about 2 centimeters above the lateral epicondyle, and another one on the medial epicondyle, again, put 2 centimeters above that. And they would go in near the portal on the medial epicondyle, and they removed a capsule that then revealed the extensor carpi radialis brevis tendon, which is the main tendon that tends to aggravate those with lateral epicondylitis. And then they would debride, they would follow the tendon from that, and then they would be able to debride that without damaging the UCL. For the PRP injections, there was going to be a single entry at first over the lateral epicondyle in the area that was the most tender. And then there were 3 other separate, they called it stabs, that were made into the common extensor tendons, and platelet-rich plasma was injected there. And this would cause a slight muscle spasm in the extensor carpi radialis brevis muscle, as well as the common extensor muscles. So some of the results. So prior to the introduction of PRP injections, which I stated earlier was 2008 to 2012, 52 patients underwent arthroscopic surgery for lateral epicondylitis. So that was a mean of about 12.75 a year. And then 4 years after the introduction of PRP injections, this went down to having 17 surgeries. So that was 4.25 a year. So the Pearson's chi-squared test showed a significant fall in the number of arthroscopic releases, and it was a Pearson quotient of less than 0.001. Since 2012, 64 patients have undergone PRP injections, with only 8 progressing to have arthroscopic surgery. Of these patients, 0 had grade 1 changes, 4 had grade 2, and 4 had grade 3. There was a significant reduction in patients requiring surgery since the introduction of PRP injections, which led us to an absolute risk ratio or risk reduction of 0.773. A little bit of discussion. So from the study, we were able to see that PRP injections are able to give long-term improvements in symptoms. They found that it also, the PRP injections increased collagen production and cell viability, and it was an acceptable and useful treatment. The way they were able to do that was they were able to see that 56 out of 64 patients that were in this study had improvements in their lateral epicondylitis, and that is 87.5%. The only downfall of this study was that it was retrospective, so when selecting the patients, there may have been some sampling errors. Thank you.